My wife and I were at a college basketball game. When we got up to leave, as we were on the concourse, I fainted, woke up immediately, but, to the sound of my wife screaming, so that was a little nerve-wracking.
It was pretty traumatic, him falling out and the paramedics saying, look, you really should go see a cardiologist.
Well, it started when he was a baby. He was diagnosed with a heart murmur, but the doctor thought he would be okay. As he became an adult, other little things started to crop up that would concern us.
As a father, of course, I was worried that it would continually get worse. So I knew sooner or later that we'd have to face surgery.
I went to my primary care physician. He said, you've got a pronounced heart murmur. You seem in good health, so maybe it was just some sort of blood pressure spike, but go see this cardiologist. He put it off for a while going to the cardiologist, and he showed no other signs that there was anything wrong. But then when he finally went, the cardiologist says, oh, well, we need to keep an eye on this. And then when he would go back for his follow-ups, it's like, oh, instead of a few years of you needing surgery, maybe in a few months. Oh, maybe this month, and so it just kind of progressed into this really urgent thing, still with him showing no outward signs of anything being wrong.
Our primary interest is heart valve disease, the treatment of heart valve disease, and this is a fairly common problem. It's probably under-recognized, underdiagnosed.
And leading up to it, that last week, there were times when I was thinking, okay, am I going to see any of these things? Am I going to see another Christmas? What's going to happen? Even no matter how calm and relaxed you are about the whole thing, it is major surgery. So there is that risk involved, and you're always going to think that way. He scheduled me to meet with Dr. Gammie. I sat down with him and with Mary Santos. They told me what was going to happen and explained the whole thing, and they put me at ease,
We were thinking that maybe he might have to have open heart surgery, but this procedure that they did went through the side, so that they didn't have to crack any ribs, and we were happy about that could go that way.
This typical approach for someone who needs heart surgery is an incision down the middle of the chest. And we think, and our patients think, that it would be better to have a less invasive approach. And so our approach has been to use a 2-inch incision on the right side of the chest. And we've found, and we've learned over time, that we can do the operation just as well this way as with the traditional large incision, with the benefit to our patients being that they can get better faster and get back to work, and it interferes with their life less.
Dr. Gammie has quite an expertise in mitral valve surgery, and there are really 2 types of patients that he approaches. One are those who are identified by outside physicians who will need mitral valve repair, and they're ideal candidates frequently for his minimally invasive repair with a short length of stay and low morbidity, in other words, low complication rate. And with those patients, I typically work with him as a diagnostic imaging expert.
They let us know that Leon was an excellent candidate for the surgery. And so I had no qualms about sending him through, putting them in their hands. Both of them asked thorough questions, asked a lot about his medical history, stuff that it would have never occurred to us to bring up. And so that made us feel really comfortable that he was the right age. Now was the right time to do it. Don't wait for something else to happen.
After the patients actually arrive here to our hospital, not only am I going to be the one to help perform the history and physical on these patients in the clinic with Dr. Gammie for the mitral valve surgery patients, I will also a lot of the time be his assistant in the operating room. So I know a lot about what actually went on for their actual surgery. In addition to that, I follow them while they're in the hospital post-operatively to check on them and see how they're doing. And then after they're discharged from the hospital, if they have any questions or any problems, or if their family members have any questions or problems anytime during their hospital stay or thereafter, they're always available to talk to me anytime that they feel like it.
Well, of course, that day, as you can imagine, I was a wreck. But I, held on. Once we got there, met with Dr. Gammie, he explained the whole procedure. that really relaxed me quite a bit. I had a lot of confidence in him, the hospital, and the doctors.
I think that we bring a little bit of both areas. We're an extension of the physician. We're also an extension of the nurse. And I think that our job has a good piece of nursing in it. I think that brings the human side to the patients and to their families. I think they appreciate our ability to deal with them on multiple levels. We're not just the surgeon operating on them. We're not just the nurse at the bedside, but we're a little bit of both.
We've been able to grow our volumes here so that we're doing almost one mitral valve operation a day. We're up to almost 200 mitral valve operations a year, and that allows us, I think, to do a good job taking care of folks.
He just said it seemed like a month, and to me it seemed like even less than that, that he went from just getting out of bed, and it was a big deal to walk downstairs, and it was then a big deal to walk the dog, to now it's not even talked about anymore. That's not even, now we talk about other things.